So first off, you cannot get COVID from the COVID vaccine. There's no live virus, there's no COVID in the COVID vaccine. Overall, the COVID vaccines, Moderna and Pfizer, are what we call reactogenic vaccines, meaning we do expect most people to have some sort of reaction. And it's kind of a good thing. I'm kind of glad when people have a little bit of a reaction. It just shows us that the immune system is recognizing that something's there, is firing up, and is doing what it's supposed to create a response so that you won't get COVID when COVID really shows up. The common reactions, most common, is going to be some local reaction, a sore arm. Only 1% of people are going to label that as severe. Otherwise, maybe you have other muscle aches, maybe you have fatigue, maybe you have a headache, low chance of having a fever. You could treat any of these things with Tylenol or any of the other over-the-counter medicines, Advil, Aleve, Motrin, if there's not some reason for you not to take those otherwise. We generally don't recommend that people take any of those medicines before they get their vaccine because we worry that that could interfere perhaps with the immune response. But after the fact, after you've had your vaccine, go for it. Treat those symptoms. Personally, I had the Pfizer vaccine. I've had both of my doses. After the first dose, I had a sore arm. The second dose, my arm wasn't as bad, but I had a headache and I was a little more tired than usual. But here I am. My arms are still here and I'm alive and well. Side effects are more common with the second shot versus the first shot and seem to be more common in younger patients rather than older patients. As the vaccines start rolling out to the public, there's no end in sight to these questions. Visit firstprimarycare.com to find a doctor you can easily connect with via text, phone, or in person.